Welcome to the Chad G Ortho OT podcast. I'm your host, Chad Guerrero. I'm an orthopedic occupational therapist, strength and conditioning coach, sports trainer, and I hold over 40 specialty certifications in manual therapy, orthopedics, and sports medicine. On this podcast, we will discuss everything orthopedic therapy, sports medicine, and more. If you're a therapist, health and fitness professional, or someone just wanting to learn more about the orthopedic and sports medicine world, then this is a podcast for you. Let's get started. Hey everyone, welcome to another episode of the Chad G Ortho OT podcast. I'm your host, Chad Guerrero, and today we're going to talk about Piriformis Syndrome and Sciatica. Okay, so, if you're having this pain over in your glute and, maybe almost like right dead center, and it may or may not travel down the back of your leg, and it may radiate up to your back, then you could be suffering from Piriformis Syndrome that's causing some compression on the sciatic nerve. Now, just discussing a little bit of anatomy, the piriformis muscle, you have two of those muscles, one on each side back there. And they're coming off your sacrum, so just above the tailbone, and that's coming over to the femur, to your bone between your hip and your knee. And it assists with some rotation, some stability, different positions, helping to bring the leg out to the side, different things, just depending on the position that your leg and hip is in. And so this muscle, it's a pretty small muscle, and the sciatic nerve comes off what's called the lumbar plexus, a bundle of nerves in the low back area. You have two sciatic nerves, and they come off each side and go down the back of the leg. And this nerve either passes behind, or in some cases, between the piriformis muscle. And there is some research out there that will show that it actually could be on top of. That's not very common. I don't have any numbers specific to say how common that is, but I've read numbers as far as going between a split in the piriformis muscle is around 40% of the population, give or take. But anyway, if the piriformis muscle becomes, spasmed, tight, or maybe you have strained it, you've been out in the yard one day, picking up some things, bending over, working in the yard, whatever, you may not have noticed it at the time. But you may wake up the next day or several days later and you start having this pain back there in the glute. Almost feels like you need to put your fist like right on the side in the glute. I've had people say they feel better if they sit on a tennis ball or if they sit on their foot, things like that, on their opposite foot, put that under there. And just that pressure feels better and gives a little bit of relief. And you may notice, like I said, that it radiates down the leg. It doesn't always radiate down the leg, especially to the foot or past the knee. I mean, it could, but it usually does not. And most of the time, if you have a nerve root issue, something going on with a disc or with like stenosis or a bone spur, things like that, the spinal cord level, then that is more likely to radiate down to the foot. And you may notice that on the outside of the foot, the small toe, things like that, on the bottom of the foot on that outside. So it's just a really easy test to check this is, let's say that this is your right side that you're having problems with, okay? So lie on your left side, on the bed or wherever, and lie on your left side, and then you bring your leg across, all right? So you bring that right leg across, like you're going to hug on one of those body pillow things, kind of, you've got the hip bent into what's called flexion, and you've got the knee bent, and you're just kind of throwing it over and see if that increases your pain or reproduces your symptoms. And, there are other tests that you can do with that, but that's the most simple one just to do at home to check and see if this is, in fact, possibly Piriformis Syndrome. And, of course, as always, make sure you're cleared by your doctor before you do anything like that, because this podcast does not replace in-person medical advice. So there's my disclaimer. So make sure you're okay before you do it anyway. And so, if you have a reproduction of the symptoms, then you could be suffering from Piriformis Syndrome. And so the thing that a lot of people try to do right away, like, well, I got to stretch it. And there's a really good stretch, and I'm not really sure how to even describe it without you seeing it. I have a video. I know it's on TikTok, and I think on my YouTube channel that shows this stretch. And there is a good stretch for the piriformis that you can do. There's actually a couple of different ones, but there's one in particular that I really like. But the thing about it is, it's not just stretching it. Because a lot of times by the time that you go to therapy or you go to your doctor or whatever, you've been suffering with this for a while. You probably have already looked up some stretches, right? You've tried that and it doesn't work. And so in a lot of cases, you need to do maybe some strengthening. And I would say more so than really the strengthening is just, muscle contraction. So contracting the piriformis muscle just to kind of load the tissue, put it under tension, and desensitize the area. Basically, you're trying to interrupt that signal to the brain that keeps saying something's wrong, and maybe there is some irritation or something wrong, but by doing light contractions, not hard, not things you do at the gym with workout equipment and all that, just gentle, light contractions can help to desensitize that area. So you can do a combination of stretches, and you can do and the exercises, or strengthening or loading exercises. Because sometimes if you take something that's already slacking, right, it's weak and it's slacking, you stretch it even more. Well, wait a minute. Well, that didn't improve things any, just made things worse. And so, a lot of times too, this has been going on for a while. So you don't want to wait 2 weeks. I'm just going to try stretching for 2 weeks, or just going to try the exercises for 2 weeks and see if it helps. No, you probably, you don't want to keep waiting, because if it doesn't help, then you're going to switch over. So I usually tell people, you know what, it's not going to hurt anything. Let's do both. One of the two definitely has got to help, maybe both are needed. And, it's pretty effective and you can resolve it. It's also very common in women, especially females, pregnant females. Changes in body weight, fluid changes, all those types of things can increase your chances or risk of developing that. Sometimes, like I said, there may be this one thing that you really remember. You've been over, you overstretched, you ran, whatever it was, and or at the gym working out, and you felt it happen, and bam, there it is. Or it may be something that you have no idea what you've done, right? It just starts to come on you, and a lot of people will panic because they think something's wrong at the level of the spine. Right, something's wrong with my disc, or I've got, I'm going to have back surgery, and all these kind of things. And in actuality, that's very not much the case. It's probably not that, right? And especially if it's not been going on for a while, months and months, or years and years, or whatever, then it's probably not that. Because you hate to even go. Sometimes you go in the doctor or the therapist or wherever you go, or whatever, however your stuff works. If you have the therapist has direct access, can order imaging, or the physician orders imaging, or whatever, and you go in there and they see arthritis. I hate when they give that, well, you've got arthritis in the back. That's your problem. Okay, well, I had arthritis a week ago, and it didn't really bother me. And then I was outside playing with my kids or whatever, and now I've got all, my back or my hip or whatever is killing me. So I hate the arthritis diagnosis, because that's an easy kind of cop out, I guess you'd say. I mean, it's just an easy one to try to scapegoat. Not saying that that's not a causative factor sometimes. I'm not saying that physicians or other therapists are wrong. I'm just saying, just kind of tell yourself that and make it make sense to yourself, and it won't make sense, right? So anyway, I hope that helps, guys. That is Piriformis Syndrome, where there is compression of the sciatic nerve in and around the piriformis muscle, or the piriformis muscle itself is just irritated and spasmed. And so very easy to treat. I will check my YouTube and TikTok to see if those videos are on there showing demonstrating the stretches and the little exercises. If not, I'm going to actually shoot those videos. I may do it by the time that this comes out. They may already be out on the channel, so you can just check that out. You can go to my website, my Chad G. Ortho OT website, and go down there and click on the link for my YouTube channel, and it takes you directly to it. All of my other social media links and all are on there. I'm also an affiliate member with Functional Movement Systems, Edge Mobility. I've got some more that are coming. And so if you just scroll down the bottom of the page, you can click on those links, and that will take you to Edge Mobility or Functional Movement Systems. And there's some great sales on products and things like that, as far as educational courses and, workout materials and things like that. So thanks so much for listening, guys. I appreciate you all very, very much. I appreciate the support, and you guys have an awesome day. This podcast is brought to you by Guerrero Rehabilitation, setting the bar for rehabilitative and sports medicine care.